Hello, very interesting study published in JNCI in July 2021 issue, study by the group of Susan Hankinson on the role of central adiposity versus BMI in the subsequent risk of breast cancer. So as you probably know, an increased BMI, body mass index, has been associated with a higher risk of post-menopausal breast cancer and with a protective effect on premenopausal breast cancer. So in summary, based on epidemiological study, we know that overweight, obese women they have a higher risk of developing breast cancer post-menopause. Instead of lean girls, they have a higher risk of developing breast cancer in premenopausal, in the premenopausal status. And so that's always been kind of interesting why there is this dichotomy between body weight and the risk of developing post on menopausal breast cancer. And this study, these epidemiological studies, suggests that it's not really BMI that we have to look at, but it's waist circumference. And in this study, as you can see here, the summary of the study is that central adiposity, so an increased waist circumference, is positively associated with both pre and postmenopausal breast cancer, independent of BMI. Okay, so this is the summary of the study. Now, if you want to hear a bit more about my input explanation about these, first of all, let's look at the data. So basically, for premenopausal breast cancer, a higher waist-hip ratio increases the risk of developing premenopausal breast cancer by 27%, especially for the estrogen receptor negative and progesterone receptor negative tumors. And for postmenopausal breast cancer, waist circumference and waist hip ratio is also increasing the risk by 59%. Okay, so both tumors, especially those that are estrogen receptor positive, progesterone receptor positive breast cancer, are increased by an increased waist circumference independent of BMI. So the reason is that probably the premenopausal breast cancer are linked with mechanisms that go beyond the estrogens, because we know that women that have higher body fat, they have higher circulating estrogens because the aromatases enzyme transform the substrates into estrogens. But the increased waist circumference, as I explained in other videos, is also increasing inflammation, is increasing insulin resistance, and therefore compensatory hyperinsulinemia, is responsible for a reduction in IGF PP1, PP2 with more bioavailable IGF-1, and a reduction in steroid hormone binding globulin with more bioavailable testosterone estrogens. And accumulating data suggest that these excessive central adiposity is also responsible for immune dysfunction, and in terms of being the immune system being less able to recognize and kill cancer cells. So that's probably the explanation why waist circumference, measuring your waist circumference, is a much better marker of the risk of not only breast cancer, but also colon, endometrial, and liver, and many other cancers, and also cardiovascular disease, dementia, than body weight by itself. because again, the distribution of the fat deposition is very important for several reasons that I've already explained in other videos. So check your waist circumference and try to lose to reduce your waist as much as you can. Every centimeters count, and is important that you gain muscle mass, especially in the leg and gluteal, the femoral gluteal, because that improves insulin sensitivity and therefore is reducing inflammation and compensatory hyperinsulinemia, and therefore also helps to reduce your waist circumference, as we have been published in several papers with John Hollatz. Thank you for listening.